Non-motor symptoms develop before the motor symptoms, in fact, in many cases. So non-motor symptoms include constipation, and many people report being constipated much before they develop the first signs of Parkinson's disease that a neurologist can discover. Then loss of sense of smell is also an early phenomenon, but many patients do not know about it, do not pay attention. Of course, many people also develop low back pain or other types of pain, which they ascribe to age rather than to the disease. So these are very early manifestations. In some patients also there are cognitive changes that occur early, but in most these are late phenomena that will appear during the disease course. The non-motor symptoms are very heterogeneous. So it's one thing to see whether the patient has lost the sense of smell. This can be measured in, there are scales, there are different ways to measure this. Other people have constipation, other people have pain, and of course all this cannot be put into one bag. There are different ones, and each one is individual. Many patients with Parkinson's disease are depressed. They may have been depressed even before the onset of the motor symptoms as well. So again, this is something that needs to be studied individually and assessed individually in each patient according to their manifestations. Cognitive decline is a huge problem because eventually most patients with Parkinson's disease will develop cognitive decline. In many cases, the cognitive decline is part and parcel of the Parkinson's disease, but in others it is due to different reasons. So of course, people with Parkinson's disease are not young and can develop other age-associated disorders like Alzheimer's disease and vascular changes in the brain. Of course, both of these are more common than Parkinson's disease itself, so the combination is not unusual. And therefore, the first thing is to assess what is the contribution of other factors to the cognitive impairment. What we tell patients who have cognitive impairment in general in that age is that the important thing is to keep fit and healthy. So control your blood pressure, things like that, lipid should be treated and so on. So this is in general. Patients with Parkinson's disease may have special problems that will add to the burden of cognitive impairment. One could be sleep apnea. They stop breathing at night, and this or snore, and this is something that we can treat. Others have falls of blood pressure rather than high blood pressure, partly due to medication, and this is also something that we have to look for and try to correct if this happens, because this is a heterogenic problem, and so on and so on. We have, in terms of drugs, we have very limited armamentarium. We have the drugs that are approved for Alzheimer's disease are also helpful in Parkinson's disease, but their effect in Alzheimer's disease and in Parkinson's disease is unfortunately very small, and we are still looking for some magic bullets that can help our patients better.